You're live.
Hey guys, it's Dr. Emer and we are in Manhattan and we're doing a treatment that I've been doing for many years for certain types of patients that have more facial volume loss and want to get a long-term improvement. We have been using silicone in micro-droplet fashion for many years. It's known in the community as being very safe for acne scars and long-term facial volumization in the micro-droplet form. So here I am injecting very small amounts, and you can see I'm following a pattern. The negative to injecting the silicone, besides the fact that if it doesn't have a good outcome is long-term, is that it hurts when you inject because there's no lidocaine in there.
Hello from the Dominican Republic.
Hey guys, you can't inject this with lidocaine. It changes the consistency. And we need the silicone to be viscous. We want collagen to produce. We're moving all the way back. You can only do a certain amount at a time and be safe. And Nick has been a patient of mine for a long time, and he's gone through the process, and now he's reaping the rewards. Actually, what's going to happen now is as everybody else ages, he's not, because the collagen is going to keep being produced. So you can see we're going and doing little baby injections throughout, and it's improving a lot. I feel bad because it can hurt. Okay, and then we work our way down.
For those that just tuned in, tell us what you're doing.
This is silicone. Hey guys, this is liquid silicone for facial atrophy or facial contouring, and we're doing what's called the micro-droplet technique. This is baby injections to give some volumization. We're going to switch the ice pack in 1 second. Hold on. Give them a little break. Okay. And I try not to do too much into the trough area because it's more of a dangerous area for silicone in terms of the results. But if you do just a little, it's fine. Okay, now switch the ice pack over here. Take that, go on, put that right there. Now switch the needle.
How long does this last?
Permanent.
Permanent.
So tell them, this is permanent.
Now, does it hurt?
Yes. It hurts. He's just acting like it doesn't.
But the pinches, yeah.
He's a strong guy. It hurts, especially as we do more pinches. So we do micro droplets, very small.
Hello from Salt Lake. Jen says you're her idol.
Thanks, guys. That's very sweet.
Jen from Salt Lake City.
Thank you. So you see we're doing very small. This is not like regular fillers. We're lifting the area slowly. And this is a process that we do every few months to build. And we're going to work our way back to fill the whole area.
New people tuning in. What are you injecting? So he's injecting silicone
For
facial sculpting.
And how are we
It's
doing
going to
it?
produce collagen. Very little though. He doesn't put a lot.
What is it called?
Silicone.
No, the technique. Technique is the
Micro-droplets.
micro-droplet technique that we're doing to get silicone in. Only certain select people can have this done. It's not my go-to filler in most cases because it's over time.
Now, what's the most painful area to put filler in?
They're everywhere is painful. They're all the same. What do you think, Nick? Under eye? Where's the most?
I guess, yeah.
Be careful.
Without
Just
touching.
tell them, don't hit. Where, cheek or what?
Towards the ear.
Towards the ear area. Yeah, a lot of people say back towards the ear.
Hello from El Paso. Gabby says hello.
So micro-droplet technique requires a lot of pokes. Okay, but we also have to limit how much we do. One more row. only do a certain amount per time. So we'll see. If I get too filled, then I don't do the temple. If I do, if I don't, then I do the temple. Always remember, dab, never rub.
Oh, from Madrid. Hi, Madrid.
So you see, micro-droplet requires us to do little injections.
Can you use cannula for this, or any possibility you would?
No. Cannot use cannula. You can get what's called a string of pearls sign. You can form a ring or a line. Remember, what is the technique called?
Micro-droplet.
Micro-droplet. That's the technique. You cannot do anything else with silicone.
That's why he's doing more pokes,
It's
because
required. Okay, give me that ice pack. Hold on. Let's switch it over. Hold right there. Good. Okay. Now we're going to go back. Hold on.
Hi, Sarah. He's injecting a silicone into the cheeks for facial sculpting, giving it more volume.
Yeah, you can tell them loud. Keep telling them what we're doing.
Now you can see right here on the cheeks, he's adding more volume. Now he's not just adding the filler all at once. He's doing what a technique called micro-droplets. So what he does is he pokes in, he pokes out, very small amount. Because adding a lot or using a cannula is not good for this technique.
No, and it could lead fibrosis, scarring, lumps and bumps. You don't want that.
Hi, Winter. Now, what is the advantage of silicone over hyaluronic acid?
Permanent, guys. You know the answer. Go ahead and tell them.
Sarah knows. Sarah said it's permanent.
This is permanent, but what does that mean if you get a problem? It's permanent. Can't reverse it. So for younger patients where they don't really have any long-term issues, it's better to use a hyaluronic acid sculpture or Bellafill. For patients like my patient here who we've been building over time with a specific concern, we want to do this. This is going to give him huge improvement, which it already has, and also long-term.
Now, can you do fat transfer as well?
You could, yeah. If someone had it. But again, fat goes down over time, right? You guys all know people get thinner as they age, well, they gain weight, but fat atrophies.
Now, is it common to use silicone on lips?
No, that's one place you would not use it. You wouldn't use it on lips. You wouldn't use it directly to the under eye or the hands.
And for those that don't know your history, where did you go to? Where did you study?
Study where? For what? Undergrad, medical school, residency. Which areas, guys? What do you want to know? Where am I from, Raul?
You are from Chicago.
Chicago. Did my undergrad in Chicago, did a residency in New York, first fellowship in New York, second fellowship in San Francisco. And then I moved to LA, and that's where we are now.
Yeah, for medical school, he went to Illinois.
Hold here. Hold on one second. Hold on. Give me the ice pack.
Chicago.
Right there. Full pressure. Good. Switch the needle.
University of Illinois.
All right, so that's really it, you guys. We're going to finish up here, and we will show you more as time goes on how we do these treatments. Keep following.